Welcome back to another episode of the ADHD Care podcast, where we get to explore the many facets of attention deficit hyperactivity disorder, or ADHD for short. I'm your host Archie, and today I would like us to delve into a lesser known aspect of ADHD. So I'd like us to talk about something called Sluggish Cognitive Tempo, or SCT for short. So sluggish cognitive tempo does share similarities with ADHD. So when we look at traits such as inattention, reduced ability to stay focused for sustained periods of time, getting distracted quite easily. But the key difference here, what we see with sluggish cognitive tempo, or SCT for short, it tends to manifest in a slightly different way. So individuals with SCT, they often experience a persistent sense of a mental fog, and also daydreaming, and what's characterized as mental slowness. So yeah, all of that might appear like as if they are spacey or even lethargic, leading to sort of misconception that they are lazy or unmotivated. So studies suggest that SCT symptoms are present in significant proportions of individuals that have ADHD, so ranging from about 30 to 60%. But however, SCT can also occur independently, so you don't have to have ADHD to have or be diagnosed with SCT. So you can have those traits, not necessarily then having an ADD or ADHD to accompany it. So currently there's no diagnostic sort of formal criteria that us clinicians follow to be able to diagnose SCT. But researchers have been trying to develop some rating scales and questionnaires to help to assess the presence of these traits. So the most commonly used scale is the Barkley Adult ADHD Rating Scale, and also the Child Behavior Checklist. So both scales can be used by clinicians to identify and measure sluggish cognitive tempo symptoms, so which would then allow a more comprehensive evaluation of ADHD related difficulties. So yeah, individuals with SCT often experience significant functional impairment. They may struggle with academic or professional performance. They also have difficulty with organization, time management. They may face challenges in social relationships. The next question will be, are there any specific sort of strategies or treatments that can help manage SCT symptoms? So if anything, the first step will be to actually get a proper diagnosis, if you want to call it, to meet a qualified professional who's knowledgeable and has experience of working with individuals that present with SCT, in addition to things like ADHD. So getting that assessed and diagnosed. So if there are traits that you are hearing from what I'm describing, it's maybe something that you might want to maybe do your own research, look up online, do your own research around what is SCT, see if, as I mentioned before, there are some rating scales that people can complete online, self-rating scales that are free to use, and it could be a start of a conversation that you might want to then have with another sort of professional. If you already have a diagnosis of ADHD, some of the SCT traits could be explained by the ADHD, but also could be independent to the ADHD. So again, that's something that's worth bearing in mind, certainly particularly if you think about treatment. You might also want to be thinking about, am I seeing benefits in those kind of SCT symptoms in addition to my ADHD symptoms? So you might want to have a conversation with your qualified professional who is offering you the treatment for your ADHD to see if they are, or if they did do kind of a screening or assessment for SCT, and if there are, if that hadn't been looked into, you might want to maybe explore a bit more and look at, is your current treatment plan also kind of addressing your kind of SCT symptoms as well? So it's all about setting those specific goals that will be aimed at addressing your symptoms for ADHD and the SCT. And if it's just a case of you just having SCT without ADHD, obviously the goals also have to reflect that. So I think management-wise, as I mentioned there, I think therapy is definitely recommended as an effective treatment for SCT symptoms. The use of medication, we find that some of the medications that are used for ADHD, if anything, most of them, also to some extent also have a positive impact on SCT symptoms. Other sort of treatment options include lifestyle modifications. So, just making sure, good sleeping, eating well, having good sort of routine, implementing sort of time management techniques, using sort of organizational tools that can be quite helpful. ADHD coaching as well is also found to be quite useful for individuals that struggle with SCT. So yeah, as you can see, that there's the whole host of kind of different avenues that one can kind of go down and explore when one trying to access support and treatment for their SCT symptoms. So now I'm going to play you a clip from my interview with Professor Russell Barkley a few months ago, and we discussed about all things ADHD, and we did talk about SCT. So yeah, just take a listen to this.
ADHD is now the current term and has been since the late 1990s. ADD is the earlier term for the disorder in the 1980s. So, we want people to stop using ADD, but unfortunately, clinicians and many patients have gotten hold of the term, and they tend to use it when they're referring to people who are primarily just inattentive, what we would now call ADHD inattentive presentation. They continue to call ADD, and especially people who don't have a history of impulsivity and problems with hyperactivity. But they should stop doing that, because we have a name for that other attention disorder. ADD, if it's only inattention and lacks the impulsive and lack of self-regulation, is really what we now call Sluggish Cognitive Tempo, SCT. And you can go to my website and you'll see a description of that under the fact sheets. And we've been studying that disorder for over 20 years now. But many people still think that that's ADD, and in fact, it's a separate disorder. So, in the midst of people abusing these terms for, ADHD, underneath that, there really are two attention disorders out there that we've discovered now, and only one of which is in the DSM. The other is basically a research syndrome that we continue to study actively. And indeed, there's a task force that is finishing up a review paper that'll come out at the end of the year that I'm on, in which we review all of these findings and rename the disorder. We don't like the term SCT. It's very demeaning and pejorative. It sort of implies slow-wittedness. So we're going to change it to cognitive disengagement syndrome. But that's neither here nor there. But so people have to stop using ADD to mean ADHD, and stop using ADD to mean that other attention disorder of people who are daydreamy, staring, confused, foggy, a little sleepy, lethargic, sometimes mentally confused. But that's a separate disorder. And by the way, the two overlap by 50%. People can actually have both. But that's kind of where we are with ADD. Don't use it for the real disorder, and then use SCT, or now this cognitive disengagement syndrome, for this other disorder.
Fascinating, as you heard there from Professor Barkley there, giving us his insight into sluggish cognitive tempo, which is what we've been discussing today on this podcast. Just to quickly recap, sluggish cognitive tempo, or SCT for short, is defined as an attention disorder that closely resembles signs of attention deficit hyperactivity disorder. But however, what happens here, you can be diagnosed with SCT and not have ADHD alongside it. So individuals that are diagnosed with SCT, they often experience the following symptoms: excessive daydreaming, lethargic behavior, lack of motivation, low level of physical activity, easily distracted or confused, withdrawn, unmotivated, or drowsy in some cases. They also have a poor memory retrieval, often lost in their own thoughts, staring blankly, and difficulty expressing thoughts or losing train of thoughts. Processing information could be also quite an issue for them as well. So those are, from research, are the key characteristics of someone presenting with SCT. I'm sure some of you just listening to me there, you could probably point out that some of these traits also are seen in individuals that have ADHD, particularly when you look at the inattentive part of the ADHD. So when we look at the diagnostic criteria of ADHD, there are different subcategories. We know that there are people that have combined symptoms of ADHD, so they have all three: inattention, hyperactivity, and impulsivity. And there are individuals that only have the inattentive part of the ADHD. So these are in the diagnostic criteria where we class them as ADHD inattentive subtype or inattentive presentation. So if I was to then maybe list some of the characteristics of ADHD, so things are easily distracted, which also fits into the sluggish cognitive tempo there. At lack of attention to details, just because of that lack of focusing, being in a mental fog, which is another symptom for ADHD. You can see there's a correlation there. They appear not to listen when they're being spoken to directly. So again, this is a key symptom of ADHD. Certainly for someone that has SCT, they also would struggle with being able to stay focused and take instructions and follow the instructions because of that being kind of absent-minded, spacey, if you want to call it, like away with the fairies, how they used to be classed or called. That can also lead to someone being quite forgetful in daily activities because of they're not taking on or listening or paying attention to what they're meant to be doing. Again, that's another symptom of ADHD. They also might avoid tasks that requires long or sustained mental effort, which is another symptom for ADHD, also fits in with SCT. So I can see why, SCT easily can just be explained, or us clinicians might look at it and just think that it's just inattentive ADHD that I'm hearing here. But like what I said, you can have SCT without being diagnosed with attention deficit disorder, or ADHD in this case. So like what Dr. Barkley said, Professor Barkley there, I think for anyone listening to this and wanting to find out more about sluggish cognitive tempo and the relation to ADHD, I suggest you just go on to Professor Barkley's website, which is www.russellbarkley.com. You can also look on Attitude website. They have lots of information on SCT over there, and do your own research and see if this is something that you might be struggling with, which you feel, I might not have ADHD or ADD as such, but I can see, or I can relate to these traits that I've just heard being described. So the final message that I just want to put out there to clinical staff, clinicians, professionals doing assessments for ADHD is to just educate yourself. If you're not familiar with sluggish cognitive tempo, or SCT, I would say this is something just to maybe do some research, read more about it, understand it more, because there are, as I said, most of the patients that we see, most of the clients that we see, some of them might present with traits of SCT, and it's also worth being aware of that, particularly when you're doing your assessments, so that when you think about diagnosing and also think about treatment going forward, that support treatment that you'll be offering to the client will also address their symptoms, not just of ADHD or ADD, but also of SCT. So there's lots of publications, research that's been done on this particular subject. So final message to clinicians, professionals doing ADHD assessments. I would say, if you're not familiar with SCT or sluggish cognitive tempo, I would say the first step is to educate yourself, raise more awareness, how it presents independently to ADHD. Just look at the traits themselves, and also see how it relates to ADHD. Certainly, there are, as I mentioned, there are a couple of screening questionnaires that are available that could be used as part of assessing or screening for SCT alongside ADHD in some cases. So I mentioned about the Barkley ADHD rating scale, which is used in adults. It has a section that also screens for SCT, which is very helpful. And I mentioned about the child behavior checklist, which could be used for children and young people under the age of 18, that clinicians can use as well as a screening tool.